Hello, I'm Dr. La Salvia. We're here today at DentaCare Associates. Today I'm going to answer some of the most common questions that we receive about root canal. What is a root canal treatment? A root canal treatment is when we remove the nerve that is inside of your tooth. The signs that if you need a root canal is that you will have a spontaneous pain in your tooth. For example, you're sleeping and it wakes you up because of the pain, or you're walking and the tooth is hurting you. When it's a spontaneous pain, you will need a root canal most of the time. What happens if you don't get a root canal? If you don't get a root canal, since this is an infection, if you don't take care of that, you can develop a very big infection, inflammation, and you're going to be in a lot of pain. So you need to do the root canal when you need it. Who performs the root canal? The specialist that is called endodontist. Do dentists prefer root canals of implants? It will depend. Most of the time, if you can save your tooth, you will do a root canal. If the tooth is not savable because the cavity is too big, then the treatment of option, a better option, it will be remove the tooth and place an implant. Can a root canal will save a tooth? Of course, the root canal can save a tooth as long as you will do it on time. What are the stages of a root canal treatment? A root canal treatment nowadays is very simple. You will go to the endodontist or to your dentist, and they will perform a root canal pretty much in one session. If sedation available during root canal treatment, of course, you can have a conscious sedation with nitric oxide, and you will be completely uncomfortable. Are root canal dangerous? Of course not. Actually, they're good because they're going to remove the infection that you have in your tooth. What are the possible side effects of a root canal? Maybe you can have some sensitivity after the root canal, but most of the time you will be okay and the whole pain will go away. After a root canal, most of the time you will need a crown. Why do you need a crown? Because after you do a root canal that we remove the nerve, we clean the root, and then we restore it, the tooth is going to become weak. So in order to prevent that the tooth will fracture after a root canal, you will need a crown. What if your tooth hurts after a root canal? If your tooth is sensitive after the root canal, the few days after the root canal, that is something that is going to be normal. If after a month you still have some sensitivity, it can be that the endodontist, or we miss some little accessory canals that still have a little bit of a nerve, so the tooth it can be retreated and it can be done again. If after that you still have sensitivity in your tooth, then it will be maybe because the tooth is fractured, or you will need to remove the tooth so you can place an implant. Can root canal be covered under insurance? Yes, sometimes it's covered by the insurance. I hope today I answered some of the most common questions about root canals. If you're ready to take action, please give us a call at DentaCare Associates at 954-475-9455.